And they asked me, can I get both knees operated on at the same time? The quick answer is yes. So when patients come in with knee arthritis, it's not uncommon to have two bad knees at once. Oftentimes, one knee is worse than the other, but sometimes patients say, Doc, you pick. They're both bad. They're both terrible. And they ask me, can I get both knees operated on at the same time? The quick answer is yes. We can do that, and we do that. The more nuanced answer is, let's talk about this. Because knee replacement, just a single knee replacement, is a big deal. And if you do double knee replacement at the same time, it's not twice the surgery, it's 3 times the surgery because you literally don't have a good leg to stand on. The recovery takes significantly longer, it's more painful, and therefore you're going to be taking more pain medications and having more side effects from the pain medications. It's going to test your psychological strength because it's going to take a long time to get to the point where you feel like, okay, I can see the light at the end of the tunnel. And it's different than having one knee replaced. It's just inherently a different thing. So the patients who are ones in whom I think they are good candidates for a simultaneous bilateral knee replacement tend to be younger, have to be very healthy, have to have a wonderful home setup for family at home to help with recovery, have to have equally bad arthritis in both knees, and then have to understand psychologically this is going to be a big challenge and they need to be able to clear their schedule and not have to go back to work within 3 or 4 weeks because it's going to take a good 6 to 8 weeks to get to the point where they feel like they want to just go out and face the world. So I would say of most patients who come in who are gung-ho to have simultaneous bilateral knee replacements, we end up doing maybe about 10% of those patients in that fashion. And the rest of them will say, yeah, okay, after talking about that, maybe we should do one and then the other. And almost every one of those patients, after we do the first side, say, oh, I'm so glad I didn't do the second side at the same time. This was a bigger deal than I thought it was going to be. So it's definitely doable, and I do it, but we try to take a very nuanced approach to whether it's the right thing to do for that particular patient.